So you might have a ringing or a buzzing in your ears. That may be what you hear, but it doesn't have to be. Some of you might have almost like a hissing sound or a whistling sound you may sort of hear. Some people hear a chirping and others hear buzzing or humming. For some people, it's a low roar, and some people, it's a higher squeal. And for some people, the sounds are continuous, meaning they last all the time. And some people, it comes and goes. And it can vary between whether it's one ear or both ears. What are we talking about? Well, we're talking about ringing in the ears, which, by the way, doesn't have to just be ringing, as I just mentioned. This is also called tinnitus or tinnitus. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. We are talking about this very important topic of ringing in your ears. It is tough, guys. It is tough for patients. It is tough for doctors as well. I'm going to tell you what causes it and also what you can do about it. Now, let's start with one of the most common causes of ringing in the ears. And this is not going to surprise you. That is exposure to loud noises, right? It can be a sort of sudden burst loud noise exposure, or it can be prolonged loud noise exposure. Think about when you've gone to a concert, right? A very loud concert. When you get back in the car, when you get home, you can still sometimes hear your ears ringing, right? So you know exactly what I'm talking about. Exposure to loud noises can be a very common cause of ringing in the ears. Before I tell you other causes of ringing in the ears, I want you to write in the comments. Let me know. Do you struggle with ringing in the ears? Do you have a diagnosis for it? Has a doctor told you why you have it? Do you know why you have it? Give us some information. I always say write in the comments because I know that other people reading the comments might very well benefit from what you have to say, okay? Now, ringing in the ears we think of as a symptom, okay? There may be an underlying cause, but to be honest with you, in a lot of cases, we don't actually find the cause, okay? But that's one of the reasons why knowing what potential causes of ringing in the ears is, that's why it's so important. So let's go through some others, okay? And this list is super important because if you're sitting at home and you know you have ringing or buzzing in the ears, you know, I always say I want you to see a doctor, but these are some of the reasons why. Okay, I got my trusty list here. All right, first of all, is anything that sort of affects the ear. It can be as simple as your ear is plugged with earwax. That could cause ringing in the ears, believe it or not, right? So don't blow these symptoms off. If you're watching this video, I know you're not already, but it's important that you don't blow it off. Also, things like ear infections, whether it's a swimmer's ear, an otitis externa, or an otitis media, that's an inner ear infection or what have you, or other types of infections of the ear, they can actually cause ringing of the ears, okay? So there can be an underlying infectious cause that could potentially be treated and hopefully fix your ringing in the ears if that's the issue. There can be changes to the bones in the middle ear. Otosclerosis can do it. If you have a hole in your tympanic membrane, a perforated tympanic membrane, that could contribute to ringing in the ears or this sort of sensation that you have. Of course, we talked about exposure to loud noises, and it's not just, say, a one-time exposure, but it could be, look, if you work in a field where you're exposed to loud noises all the time, I was going to say this at the end of the video, but I'll say it now. Make sure that you're wearing your PPE. You need to be wearing hearing protection. It is so, so, so important. There's also autoimmune hearing loss, okay? So autoimmune hearing loss and autoimmune hearing diseases can contribute to ringing in the ears. Also, certain conditions that have ringing in the ears as sort of a symptom or a part of it, like Meniere's disease. That's basically a condition that affects the inner ear, okay? Other problems with the inner ear can actually cause ringing in the ears too. Believe it or not, TMJ, yeah, temporomandibular joint dysfunction can actually contribute to ringing in the ears, believe it or not. Isn't this amazing how like wide-ranging this list is? And that's why it's really important to know. And I'm not listing everything. I'm listing a lot of things, but not everything, which is why don't blow off your ringing in the ears, because it literally could be something that is treatable, fixable, underlying, etc. It's certainly something that needs to be evaluated nonetheless, okay? Now, the other thing you should know, believe it or not, medications can do it. There are certain medications that are known to cause ringing in the ears or hearing problems, things like that. Also, of course, things like head trauma or brain tumors could do it. There are other neurological diseases, right? There have been case reports of people with multiple sclerosis or other neurological diseases that have ringing in the ears. But also, I've also read that Lyme disease, as a sort of sequela or as something that may happen down the line, that has been something that people have reported as getting ringing in the ears. Thyroid disease disease, diabetes, stroke, issues with your blood vessels as well. Now, there's sometimes people get what we call like a pulsatile sort of a sensation that they hear, and that pulsatile sensation may be more related to blood vessels and cardiovascular disease, etc., which is why, once again, if you hear a ringing in your ears or a whooshing, right, I want you to see your doctor, because it could be an indicator of something underlying that needs to be evaluated and looked at, okay? There are plenty of other potential causes, but you get my drift, right? I know it seems like a long list, but this is important to know because there are potentially a number of things that may be going on underlying that could be fixed. Look, if it's just earwax, hopefully they can take it out and you're good to go. You're good as golden, okay? But let's just also sort of take a 50,000-foot view of this. Ringing in the ears can be tough. Okay, I'm not even going to sugarcoat it. I'm not going to act like, oh, just go to your doctor, find the cause and get it treated. Because the truth of the matter is that oftentimes we either can't find a cause or maybe it's not so quickly or easily treated. And sometimes ringing in the ears can be quite distressing. It can be uncomfortable. It can be disturbing. It can cause distress in one's life. It can be aggravating. And I want to be very, very, very real about this, which is why I want you to be working with your healthcare provider, your ENT doctor, who's going to be so clutch in this. As a family doctor, one of the first things I do, besides taking a history and physical and doing everything I can do, is then referring to my ENT specialists for my patients. They can do audiology exams. They can check hearing. They can check your ear in different ways and may consider imaging studies and things like that. But understand, yes, this can be tough. So if you're struggling with it, look, I hear you and I see you. And I don't want you to feel like you're alone. Speaking of which, it's estimated that like 50 million people in the United States experience ringing in the ears, which I think is massive. It's a lot of things. So you're probably wondering, okay, what do we do? All right. Obviously, if we can treat the underlying cause, that is what we do. That may include things like hearing aids or medications. There are actually sound masking devices, believe it or not. Sometimes we don't find a cause. Sometimes we utilize things like cognitive behavioral therapy or therapy to help people sort of cope and deal with the living situation that they have with ringing in the ears. The first thing I think is really important is to be hopeful and to know that you should get evaluated. You need to see your doctor, have them take a look at you, listen to you, ask you questions. You need to see a specialist and start on the path of trying to figure out if there's something that can be done, what may be going on. Okay, guys? Once again, let me know in the comments if you're dealing with ringing in the ears. Let me know if you've gotten a diagnosis, what's helped you, what's not. Make sure again that you are seeing your doctor, talking to an ENT. This is very important. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos for those of you who are on Facebook and YouTube. I love you guys. On Facebook, make sure you like and follow my page. For those of you who send stars, I respond to you personally. Thanks so much. Also consider joining my subscription groups. And on YouTube, hello, please subscribe to my channel and click the little bell for updates, guys. I'm Dr. Jen. I'll see you soon.